Stamford Health is kicking off a new initiative. It's meant to make mammograms more fun. The program is actually called a Glammogram, encouraging patients to prioritize their health. And here now to tell us how it works is Dr. Mia Kazanjian, Stamford Health's Breast Center co-director and chief of women's imaging. So thank you so much for being here. Let's start out with the basics. Who needs to be getting a mammogram, and why is it so important?
Every woman starting at age 40 and every year should have a screening mammogram. That's super important for women at higher risk. That screening should start earlier. Our society actually recommends that women starting at the age of 25 have a risk assessment to determine if they should start screening sooner. Screening mammograms can find breast cancers when they are tiny, when they're little millimeters in size. Over the years, screening mammograms have been shown to decrease mortality from breast cancer by about 30%.
Clearly a lot at stake here. Now, tell us about Glammogram. What kind of perks can people enjoy through this program? How does the program work?
I thought of the idea and the name of Glammogram to really pair the concept of a woman doing something glamorous for herself and a woman having a mammogram. And it's really about self-care. We planned and hosted an event, first one of which was on Saturday. And so for every woman who had her mammogram that day, her screening mammo, she could choose to either have a manicure or a massage right afterward to make her feel special, to make her feel glamorous, to make her feel empowered, really, that she did something that's so incredibly important for her health.
Such a cool program. And as you mentioned, Stamford Health had their first Glammogram event of the year on Saturday. How was the turnout?
Jane, the turnout was great. You know, as some of them were waiting, we just chatted. You could just tell their eyes were lit up. They were excited. We were talking about different colors. It lightened the mood.
From your perspective, what is typically the drawback for patients or reasons that they might put off a mammogram? And do you feel that a Glammogram helps draw more people in?
In the wake of COVID-19, Jane, we had a lot of women during the pandemic not come in. Now, screening was suspended for several months at the peak of COVID. That definitely threw people out of their cycles. We saw some women not come for 2 years, 3 years, now 4 years. We definitely found more cancers in that short period of time, right when women did start coming back in bulk. The cancers that we did find in women who waited longer were bigger. So I think that's really important. How cool is it that we have the technology to see inside our bodies so that we can detect cancer when it's tiny, or potentially even prevent it? This is all about women feeling empowered to take care of themselves.
So important to talk about those preventative measures. All right, Dr. Kazanjian with Stamford Health, thank you so much for your time and for your insight tonight.